As you just heard, the state mask mandate is on its way out, but not quite yet, and not for everyone. As we mentioned earlier, Governor J.B. Pritzker today announced the indoor mask mandate for the state of Illinois will lift on February 28th if current COVID trends keep up. But he says schools will have to wait a little bit longer, even as a recent court ruling overturning the mandate has caused confusion at districts statewide. Is this the right time to unmask? Joining us are Dr. Jessica Herrick, an associate professor of medicine in the Division of Infectious Diseases at the University of Illinois, Chicago, and Dr. Robert Murphy, professor of infectious diseases at Northwestern University's Feinberg School of Medicine. He is also the executive director of the Institute for Global Health. Welcome both of you here to Chicago tonight. First, Dr. Herrick, your reaction to this announcement today.
I think a lot of us have sort of cautious optimism. We think that numbers have been falling and things are looking better. And so if things keep going the way they've been going, I'm cautiously optimistic. What I want people to keep in mind, though, is that if the numbers start going back up, then we may have to sort of reconsider this decision.
And Dr. Murphy, Governor Pritzker is predicating the decision on projections of what hospitalizations will be on February 28th. So is February 28th the right date in your mind?
Well, February 28th is a guess. If you look at it today, there's 20 times more new infections than there were in July 2021. So we're coming down. The very steep decline in the number of cases, but we were up so high that where we are today is still really bad. There's 111,000 people hospitalized in the United States right now and 2,500 people dying per day. This is not in control yet. I don't know about February 28th. We'll find out when we get there. It's about 3 weeks away.
Yep, 3 weeks away. And Dr. Herrick, it still would be up to cities and municipalities to do what they will with their own mask ordinances. Chicago officials have hinted that they'd be ready to lift the city's mask mandate around then, too. Should Chicago follow suit?
I think it really is impossible to answer that question right now. We'll have to kind of see where things go. Again, if the numbers keep going down, then maybe it will be time for Chicago to lift the mask mandate as well. The best thing that people can do to try and make that happen is to make sure everybody gets their vaccines.
And Dr. Murphy, you mentioned that so much is unknown over the next few weeks. Let's take a look at hospitalizations. They were at 2,266 when Illinois reimposed the mandate back in August. Now they're at 2,496. So they're not below that pre-mask level yet. How much do you expect this to dip by February 28th?
Well, the problem with looking at just the hospitalization rate is it lags 2 weeks behind the infection rate. Because once you get infected, it takes about a week to get sick, and then about a week to get really sick and end up in the hospital for those that end up in the hospital. So, looking at the hospitalization rate is a little bit late. But I agree, though, the only thing that's going to control this is be vaccinated and be boosted.
And again, the governor is citing projections from his epidemiologist showing that those hospital rates are declining precipitously and will continue to do so, fingers crossed in his mind. However, the lifting of the mask mandate will not apply to schools right now. Take a look.
The equation for schools just looks different right now than it does for the general population. Schools need a little more time. For community infection rates to drop, for our youngest learners to become vaccine eligible, and for more parents to get their kids vaccinated.
Dr. Herrick, the right call to keep the mask mandate in place for schools, and how much more time do you believe schools need?
I think so for now. I think the thing to keep in mind is that as we lift the mask mandate in places around the state, people can make personal choices about whether they want to go out to dinner or go to a movie. Schools are very different. That's not really a personal choice. Everybody gets educated in our public system for the most part. And the other thing to keep in mind is a lot of schools may have preschools, and so they may have children who aren't even of the age yet that they can get vaccinated. So I think schools are just a completely different type of environment. And for now, I do agree that I think it's reasonable to keep the mask mandate going there.
And Dr. Murphy, I assume you agree with that as well, despite the current confusion because of last week's court ruling.
Yeah, we have a central state judge making health decisions, which is nothing short of ridiculous. But the thing with the schools, another reason why we've got to keep the mask in there, is that the kids, even though they're eligible for vaccination, have the lowest vaccination rates, especially the 5 to 11. It's a very poor uptake in the vaccines there. Even in the kids over 12 and older, the uptake is very low. And so put that into place with everything, and it just makes the matter even worse.
Districts still have to boost those vaccination rates. So Dr. Herrick, you mentioned concern or cautious optimism of where the state is at and where the state is going. Any concern on your part about other variants or the quote-unquote stealth Omicron?
I think obviously those are concerns for us. I think the thing to do is that, and this is where many of us in our field are very frustrated, that the way to prevent those, the way to prevent the next wave, the next, Omicron, is to have everybody get vaccinated. And, our vaccination rates are great. Dr. Pritzker mentioned in his press conference that we have kind of the best in the Midwest, but we still have a lot of room to go.
Dr. Murphy, does that mean that things like the indoor vaccination mandate should stay in place in Chicago even when the mask mandate lifts?
Absolutely, at this point. Otherwise, we're just looking for the next variant to come. The stealth variant you mentioned, it's 50% easier to transmit than Omicron, which was 300 to 600% easier to transmit than Delta. So this is it is so infectious right now.
And Dr. Herrick, there's a lot of sentiment out there from kids, from parents, from general residents that they feel like they're over COVID, they're sick of it, they're fatigued by it. What is your message to them?
You just you can't give up in the last half mile of the marathon you're running. That would be my message to them. We're not there yet. And if we keep doing all the right things, we will get there. But the virus doesn't care how we feel. It doesn't care if we feel that we're, quote, over it. It is still raging out there.
Dr. Murphy, is there any data showing concern about other variants popping up at any other parts of the world?
Well, look at, Omicron was identified in Africa November 11th, 2021. It's not been around very long, and it's taken over the world. The BA2 variant, the stealth Omicron, is only a couple weeks old, and it's already up to about 20% in some places. It's going to take over also. The virus doesn't care. The virus is not done with us.
Exactly.
Dr. Murphy, does that mean that folks that might have had COVID are not immune to the stealth Omicron variant?
Well, the people that have not had COVID or the vaccine are very much at risk. If you get Omicron, whether the BA1 or BA2, the stealth or the regular one, you're probably protected for at least 3 months. But after that, it's fair game. But if you've had the vaccine and you also got Omicron, you're what we call a hybrid patient, and you probably have very good immunity.
All right, a lot of uncertainty here, but a lot of optimism from the governor today, and cautious optimism from both of you. And our thanks to Dr. Jessica Herrick and Dr. Robert Murphy. And we'll have much more on the lifted mask mandate coming up in Spotlight Politics.